Okay, so thank you for joining us today. The last few months have been challenging to say the least, as we all have been impacted by COVID-19. We know our barbershops and hair salons have taken a huge hit during this time, and our hearts truly go out to all of you. We created this webinar just for you. So to ensure the safety of our community and help you navigate this new normal, we have created a Smart Restart Davie County guide, which will be shown today and you'll see on your screen. This comprehensive guidance includes many of the recommendations developed by the Davie County Health and Human Services, along with the guidelines from the CDC and other federal and state local agencies. The resource will act as a living document, which we will update as this situation continues to change, and the document can be found at the Chamber's website at daviechamber.com. Today's session will only be about 30 minutes, and we will leave room for you to ask questions. Also, again, this webinar is being recorded and will be sent to you. I am thrilled to have with us here today the ladies of the Davie County Health and Human Services. We have Miss Luann Angel, the public health nurse and communicable disease for Davie County. And Miss Luann, I'm going to pass it on over to you.
Thank you, Caroline, and thank you for allowing me to participate in these calls. But most importantly, thank you for all your work in the Smart Restart in Davie Playbook to assist our businesses in Davie County. And thank you to the caller who's participating. I see your name is Mina. Thank you for being with us this afternoon. I really want to thank you for the enormous sacrifices that you have made to help protect you, your families, your employees, your clients, your customers, and residents of our county. I know it's been a difficult time. We appreciate your diligence and your cooperation with the executive orders and federal, state, and local guidance in this battle against COVID-19. We know that you're anxious to reopen. We hope that today's discussion will be of benefit to help you as you prepare safely to get back to business. The pages that cover barbershops and hair salons in the document are pages 24 and 25. But also, when you go online and view the document, I would refer you back to pages 4 through 13. There are important safety recommendations, tips for communicating with your team, preparing your space, cleaning, and personal protective equipment. And those things apply to all businesses. But in the document, there are specific things for each business. Barbershops and hair salons fall under the close contact services. Your work requires direct physical contact with customers, and your goal is to do this safely in order to protect you and your customers and employees if you have employees. I want you to think about how you previously operated your business and routine safety measures that were implemented daily, such as disinfecting and cleaning, sick employee policies, to name a few. We want you to think further, though, regarding extra steps to take to protect employees and customers against COVID-19. If your shop, and I'm assuming your building has been closed and sitting idle for some time now, one thing that you can do initially is just to ensure proper operation of your building systems. When you have a reduction in water use, that can cause stagnant or standing water in the water system, which could increase the risk of growth of Legionella or other waterborne pathogens. So taking steps to ensure that your building water and water systems are safe to use. Also, consider replacing HVAC air filters or clean or disinfect existing filters. Increase your ventilation, opening windows, adjusting air conditioning, and then a good deep sanitizing your business to limit the spread of germs for you, your employees, and customers. And there is information on the CDC website regarding cleaning and appropriate EPA-approved cleaners for COVID-19. In looking at the page 24, we're talking about we'll start with employee and customer protection. And it's important to use disposable materials and supplies according to North Carolina Department of Health and Human Services. All employees should wear face masks and gloves. One face mask can be used per day, and gloves will be disposed of and changed after each client. The thing with face mask, it can be a regular face mask or a cloth face covering, but also remembering once it gets wet or soiled, then it should be changed. Cloth face coverings can be laundered, and also consider about keeping mask on hand for your customers. You can ask them to wear a mask when they come to your salon or shop, and if they get there and they don't have one, then it would be important for you to have some on hand to provide them. Another thing is making sure you and your staff are well. If anybody who has a fever or otherwise exhibiting symptoms of COVID-19 shouldn't be allowed to work. There's also when your customers call in for their appointment, make them aware up front. If they're having symptoms, if they're having illness, then it would be better if they would reschedule their appointment. A sign can be placed at the entrances that individuals who have a fever, cough, shortness of breath, or other COVID symptoms should not enter. There are signs pre-printed available on the CDC website. And then, of course, you and employees be alert to any safety or health concerns in the shop or the salon. Something to think about: when COVID first started, we were looking, CDC put out the symptoms as a fever, cough, shortness of breath, difficulty breathing. There are additional symptoms that have been added to that: headache, sore throat, myalgias or muscle aches or pains, GI symptoms like nausea, vomiting, or diarrhea. And one other that we don't think about a lot is a change in your sense of taste or smell. Some patients who've had COVID have reported that change in they just can't taste things or they just can't smell things. Everything's kind of the same. And moving on and looking at the appointments, I'm sure that you already do that by appointment only, but at this point in time, it would be better not to take walk-in customers. That way you're prepared to protect your customer and yourself. Ask your customers to wait in their vehicles until their stylist is ready to see them. Cell phones are great because you can communicate with them that way as well. The next session talks about contactless transactions, limiting cash handling, encouraging customers to use credit or debit cards, other forms of payment that are contactless, and sanitizing those point of sale equipment, pens, electronic payment terminals, pen pads after each use. If it's so that if you use a tablet for them to sign their receipt, if you can put it in a plastic sleeve so that you're not having to put that cleaner right on your tablet or your electronics each time, you can clean that sleeve and go on to your next client. Something that you guys already do a lot in your work is frequent hand washing, but just encourage hand washing by you, your staff, and your guests or your patrons, your customers, washing hands often with soap and water for at least 20 seconds. If soap and water are not available, using a 60% or greater alcohol-based hand sanitizer. Avoid touching your eyes, your nose, your mouth, and face with unwashed hands. And wash your hands after touching your face as well. Disinfection and cleaning is very key to every business that opens up and practices operates through COVID. All equipment, chairs, tables used by an employee should be sanitized between clients. Customers should be required to sanitize their hands upon entering the building. Either they can wash their hands or use hand sanitizer that you provide, and also before each treatment. no employees with COVID-19 symptoms should provide services to clients. So if someone is sick, they should not be at work, actually. Ask them to stay home. If an employee gets sick while they're at work, ask them to leave and not continue their shift because of risk of exposing you, others in your salon, and your customers. We mentioned about posting a sign outside the door about symptoms, but you could also note that if a patient has fever or other symptoms, then they must reschedule their appointment. Thinking about things like common items, books, magazines that are used a lot in salons when customers are having to wait for a few minutes to spend some time, those would be better left out of the salon right now. No books or magazines that's going to be used from person to person. Those are not things that you can clean or sanitize. Other things such as vending machines, microwaves, break room surfaces, any frequently touched surfaces need to be cleaned between use. The next section addresses social distancing. And at this point, it does, what the guidance that's there does mention the clients limited to 3 or 50% of your normal capacity. That pay attention to the floor plan, the layout of your salon, how many stations you have. Some people are a solo owner and they do, they have no other employees. So that would be easier. You can limit, it's just you and one customer at a time. Only one client per service provider if there are multiple stylists in the salon. Limiting the number of people in the building. Only those receiving services and their stylists should be allowed in the building at the same time. And barbershops or salons with 3 or fewer employees may resume operations once the restrictions have been lifted, so long as social distancing and other measures are maintained. Those who have 4 or more employees would need to stagger the work schedule so that no more than 50% of the normal number of employees will be in the building at the time. Thinking about your layout of your shop, if you have 4 stylists and 4 stations, how close are those stations to each other? Are there 2 of those that are at least 6 feet apart? So there's got to have some thought into this and think about how you would be able to maintain that 6 feet between stylists and customers. Of course, you working with your own customer, you're face to face, you're right there together. So both of you should be wearing a mask. If you provide any other services such as nail services, waxing, or massage treatments, there's further guidance under close contact services specific to nail salons and to businesses offering waxing or massage treatments. And so it's kind of in the same area, maybe a few pages before of these 2 in particular about barbershops and hair salons. That pretty much covers what I wanted to talk to you about today. And if you have any questions or concerns, I am more than happy to try to answer your questions.
Hey, Mina. Can you unmute? Hey. So I know y'all have a lot of things going on in your one area, but do you have any questions, concerns? And now's a great time to ask Miss Luann.
No, she's pretty much covered a lot of it. But we have been doing the cleaning and stuff when we're getting ready to start that once we know when we're allowed to go back to work, to get the whole salon cleaned up and stuff, and get all the restrictions and stuff in place. But is there any way we can get one of these books, or is it something that's online we can get, or are you guys mailing them out?
Yeah, so great question. So this Smart Restart Playbook is located on our website at daviechamber.com. There's a coronavirus website, or you'll see the sign or a little icon that says Playbook. You can click on that.
Okay.
And it's a long document, or I think it's like 65 pages, but it goes in depth into each step, if you will.
Okay.
So yeah, absolutely. And again, we will stay on this as things start changing. We will
Right.
be editing this as well. So
Okay. All right. Awesome. Well, thanks for all the info. That was great.
yeah. So we have a caller that joined. I'm not sure who it is because it just says Samsung.
Okay.
It's me.
It's maybe Susan. Is it Susan?
It is.
Hey,
I don't know.
Susan.
Can you hear me?
I can hear you.
I'm amazed because usually I can't do technology. So.
I think we're all forced to be able to do this now, right? We're all getting
Yes,
pushed
we
out of our
are.
comfort zones.
Yes, we are.
Well, thank you for joining us. Susan, do you have any questions for Miss Luann?
One of the questions that I have, since we do most of our services in individual treatment rooms, what I was thinking of having us do is, of course, stagger any arrival time. Just to throw it out there, let's say it was Mina at the top of the hour and I was at 15 minutes after the hour, and all clients stayed in their cars, and we would go get them and escort them straight back to the room. So my question would be, if they're not even in the same room of another worker, could there be, say, 4 people working but in separate rooms?
That's a good question. With your separate rooms, then you're able to maintain that 6 feet of distance. However, once the guidance comes out in the next phase, and they will specify capacity, and it would depend on, we're looking towards probably 50% of your normal capacity. But we don't really know the answer. We can't give you a firm answer to that question until we get that guidance from the governor's office.
Okay, and then I guess it's not any different. We have 2 totally separate sections. We have a hair salon and then we have the spa. So I would need to add in the capacity of both of those locations, correct?
Yes, ma'am.
Okay.
And you're in your hair salon, or the spa, I'm assuming, is what you do in individual rooms. In your hair salon, how close are your stations?
I've already determined we're only going to have, I'm only going to allow 2 stylists there at a time. So they're going to be one at the very back of the salon and one at the very front. So there's a good, I would say 16 feet.
Okay,
like
great.
that.
Great, that is good.
And that's already half the capacity of the employees that we have in the salon anyway, right?
Mm-hmm, yes. One other thing that I failed to mention earlier is just thinking about your attire when you're working. I know most stylists wear an apron, they put a cape on their client or customer. Just laundering frequently, staff may want to consider bringing a change of clothes to change out of before they go home, because you're in personal space, and you could have, if they sneeze or cough on you, you could get those things there. Of course, you're not going to get it just by it being on your clothing, but accidentally, if the secretions are wet, you brush it with your hand, you brush your face, touch your face, lick your lips, touch your nose, touch your eyes. It's that simple. So just thinking ahead of those little details that you can help to keep everybody safe.
There was one thing, and you may have covered this. I joined late because I was doing PPP stuff. What about just a chair in a treatment room? They come in to take off their shoes. Does that need to be totally non-porous as well?
It would be better if your client is healthy, they're not sneezing or coughing, that kind of thing. But if you have the option to use a non-porous surface, that would be better.
Okay.
Just for cleaning, or if it has a cover over it that you can launder.
Okay. All right. Thank you.
Mm-hmm.
And Susan, we have plenty of time. So if you've got more questions, now's the time. I always tell people there are no stupid questions, especially during this time. So the floor is yours.
Well, one thing that I was considering doing, and I will ask if this sounds like a good idea to you. I mean, I have hundreds of different products I use because I customize every single facial I do. Mm-hmm. So what I was thinking of doing is if each technician had like their own basket, and literally as you used any tester, now granted we don't put our fingers into any testers or anything, but they have been in the room, mm-hmm. That we would just put that straight down into a basket, not even put it back on the shelf. And then, of course, after that client has left, we can just thoroughly re-clean those things. Would that satisfy?
Yes, because you are keeping it separate from the rest of your inventory, plus you're cleaning it before the next use. So yes.
And also, I guess, like makeup and tester, I was just going to not do makeup or anything like that during
I think they're
time.
suggesting,
pack it all up.
Yeah, I think they're suggesting no testers anywhere, like makeup and products and stuff for public use, right? I believe.
Mm-hmm.
The good thing is in spas, we really mostly do all of this anyway.
Mm-hmm.
You know, I mean,
right.
we sterilize and clean. Also would love to know if this is true. I heard, of course, that, you know, soap and water helps. Well, the first step in a facial is to cleanse the skin. So that's a big plus. But I also heard that that steam is very effective. Is there any evidence that that's the case?
I do have in the document, and let me flip my papers over, there is a section that talks about surfaces and what cleaning items, steam to the face. Thinking about COVID is spread through droplets, aerosolized droplets. And thinking about steam, that's aerosolizing things. You cleanse the client's face, use the steam. That's a good question. You know, I would be kind of hesitant, but I will follow up with that and ask.
Okay. The steam my concern is the steam, of course, goes to their face, but some of that then jumps off of their face up towards us.
Absolutely.
So I don't know if we need to put a shield, which would be quite hard to do a facial with a shield, okay. Or if we've just got, the other idea could be, it'll be hard, but we could somehow maybe do the steam from the opposite direction. I don't know, but I was wondering about using steam in a facial.
You may want to consider to forego that. Certainly thinking about the fact that your client's not going to have on a mask while you're doing that facial, but your staff are. Another thing you were talking about, a shield, a medical face shield, a plastic face shield would be helpful to protect your staff, basically when they're doing those kind of procedures. But the steam is that risk is there of it aerosolizing things from the patient, from the client.
So really, the bottom line is for our safety, it would be better if we reinvent, maybe use more hot towels.
Yes, ma'am.
Instead of the steam.
Yes, ma'am.
Those face masks we were having, face shields, we were having a hard time locating.
And they are kind of earmarked for healthcare providers, but there are, I've noticed on the news, there's several companies, big companies in North Carolina have started producing those. So certainly you may, I don't have a list of those, but that may be an option.
Yeah.
We can research it.
Yeah, just to research that online.
Yeah, so Susan, what I'll do is I have in my outbox list, some emails. I will try to see some distributors of that, and I will pass that on to you.
Okay, thank you.
Yeah,
very much.
That'd
that's
be great. Yeah.
Yes.
We've got the gloves, we've got the masks, the shields, I think, also for a manicurist. You know, a hairstylist is behind the person, but a manicurist is sitting right there in front of them. So,
Absolutely.
and as an esthetician, I'm literally, I don't know, leaning over them 6 inches, 7 inches away from their face.
Mm-hmm.
I'm going to try to invent a way to do it from a distance.
There are pages in the playbook that directly address nail salons. We were sort of catering today towards barbershops and hair salons, but there's lots of information about nail salons. And thinking
Okay.
about when you do procedures like that, do your clients come in and pick out their own polish, they pick out their color, they may be handling the products on your shelves? Just if that could be handled differently so that a
Yes.
staff member, a gloved staff member may do that. They
I
can
agree.
point to what they want, and then they're not handling everything in your inventory.
I
Okay.
think that's a great idea. We should put a sign. They can look, but let you get it and hand it to them and then re-wipe it
Right.
before it's
Yeah.
re-put there for sure.
Yeah. Definitely. That can be done.
And then what if someone comes in that's, you feel they're old? I mean, you know, we have a lot of older clients. We live in the middle of 2 retirement communities.
Mm-hmm.
Do you go ahead and do them? Do you have rights to not do them? Are we liable should they get sick?
That is their risk. And as far as your decisions, it's your business, it's your private business, and you can set the rules, basically. Of course, you wouldn't want to lose that client base with that age group, but certainly discussing with them that, you know, there is a risk if they come out of, you know, that population, which I'm close to that population, where it's recommended that we stay in still. So just in speaking with your clients and say, you know, there is a risk if you come out away from home. Certainly we will try everything we can to do in our salon to protect you and our employees, but making that known up front. One thing that happens in retail businesses is particularly like grocery stores, that type of thing, they set specific hours for at-risk populations. So your client would only come at a certain time or a certain day of the week.
Right. That sounds good.
Preferably morning before you've had a lot of traffic in and out of the salon.
Right. Right.
Okay.
Very good. Thank y'all so much for doing this.
Thank you.
Yeah. So my question to you, Luann, if people, you know, like Susan and other hair salons or barbershops, if they were wanting to do like a Zoom walkthrough with you potentially, so you could actually see the layout of their shop and you could give advice if you see anything, are you willing and able to do that?
Yes, ma'am. I would be willing to do that. Yes.
Perfect.
Also, to give you our COVID call center phone number, there are nurses who man that all the time. It's 336-753-6550. And that's Monday through Friday, 8:30 to 5. After hours and weekends, it rolls over to a nurse on call. So you can reach someone. They may have to call you back, but you would be able to reach someone.
So 336-753-6550?
Yes, ma'am.
Okay, great. Very
Well,
good.
Thank you.
Yeah, well, thank you guys, and sincerely, our hearts go out to you. You guys, you know us women, we're missing our hair appointments and all that stuff. We need you guys back open hard and fast. So, but thank you for taking the time to be a part of this. And like you said, you always do a great job of having your salon clean and you're doing what's already recommended anyways. Just a couple of things have to have a special little touch or extra,
Right.
you know, sparkle to it, if you will. So I know we want to, return to our lives as normal, but thank you for taking the precautions. And if you again have additional questions, feel free to reach out to our health department and the chamber, and we will talk to you soon.
Okay.
Thank you.
Thank you,
Thank
guys.
Bye-bye.
Bye-bye.